There's not an easy and simple answer to that question. I think the most important thing is to come in for a consultation so that I can examine you. Some general points about that would be, it depends on how much sag you have. When you think about a breast that starts to sag, there's three things that are happening. You lose the fullness, you lose your cleavage, or it's not as firm as you once had it, and the nipple and areola are a lot lower than where you may want them to be. If you just have implants put in, you'll definitely get dramatic and great improvement of two of those three things, which is great fullness, great cleavage, but it doesn't change the position of the nipple and areola. And the only way to change that position would be to have a breast lift. A lot of the patients that I see, though, they don't want a breast lift because it means putting incisions on the front of the breast. And what I tell these patients is it really depends on your goal for the breast augmentation surgery. If your goal is to look great in bathing suits and bras and any type of clothing, then I think you're going to be really happy with just having breast augmentation. If your goal is that you want your breasts to look as good as they possibly can, whether you're in clothes or not, then I would tell you to think seriously about having a lift and breast augmentation surgery. But again, keep in mind, it really depends on how much breast sag you have, what size breast you have now, and what size implants you are thinking of getting. And those are things that we will talk about in very detailed manner during the consultation.